Am I getting in trouble for saying she definitely had surgery?
No.
The nose doesn't shrink on its own. And injections, injecting the nose with fillers is not going to shrink a nose. It's not a non-surgical rhinoplasty. No injections will ever shrink a nose. Hello, I'm Dr. Gary Motykie, and I'm a Beverly Hills board-certified plastic surgeon. And today I wanted to go over Bella Hadid because she is a very common topic in the news, in the media, social media, everywhere, as well as in my practice. A lot of patients bring up her look. You know, how did she get it? Some people like the look, some people think it's a little extreme. So I just wanted to go through a little bit about what she has done to herself, to her face. And I say that because a lot of times people will talk about celebrities, models, and say, well, she might have had something done, but we're not sure. She's had some surgery done. There's no doubt on this one. Just some of the things that have changed, and I don't necessarily mean it's bad or good, but she's definitely had work done. I think if we look at some of her earlier pictures, the obvious work is the nose. I mean, obviously she's had rhinoplasties done to her nose, and some of her other facial features have definitely, I think, been augmented, whether surgically or non-surgically. So if we started with her nose, you can see when she was younger, her nose was definitely more bulbous. The tip wasn't quite as refined. The nostrils weren't quite as refined. The bridge wasn't quite as low. All those things have been altered surgically. The rest of her face, from her brow down, she's really well known for the brow, for the cat eye, fox eye look kind of to her brow and her eye shaping. So I do think something was also done there. Now, it can be a combination of lateral brow lift or surgery on her brow, but that would be the most extreme thing. I think within there would also be some brow threading, BOTOX, brow reshaping, and also makeup. All of those things can't be underestimated because just contouring, doing the makeup correctly, if you look at her without makeup and makeup at the exact same time period, she can look completely different, and that has to do with her makeup artist and things that she's doing that not everybody has access to, but she does. If we go down to her lips, obviously over time her lips have gotten a little more fuller, so she's probably doing some lip injections, lip augmentation. And I do think there are changes in her mid-face and jawline. And some people are saying it's surgical, some people are not. I do think there is a possibility of a buccal lipectomy where we remove the fat pad in the cheek hair and you bring it in to make the lower face come in and give a cheek highlight and a cheek hollow. And the overall effect of that is to make the face more of an OG or a heart-shaped face and give contour to that face. So it's a really popular look, and I think it's a pretty look. And then secondly, I do think there might be some subtle changes in the strength of her jaw, and it's kind of changed a little bit over time, whether it's gotten stronger, weaker, more prominent in the mandibular area or not. Those are big surgeries to do, cut bones, move things. I think she's probably more likely done things like fillers to change the shape of the jaw. You know, subtle little things of adding to the here and subtracting from here. These little things add up.
Damn it.
You gotta be kidding me.
A few moments later.
As I was saying, looking at Bella's jawline, I do see changes in the jawline, and I think some of those things are more likely the result of non-surgical things than surgical, because the surgeries for that jaw surgery are fairly intense and extended recoveries come with risks, complications, and I think rather she was probably doing some reshaping of that jawline with different things like fillers and Botox. And what you can do with that is extend the chin and make it a little bit more refined by adding projection to the chin and contouring it. And then secondly, you can either add to the jawline here or reduce it. You add with fillers and you reduce with Botox. What the Botox does is shrink this masseter muscle and bring in the jaw. So you can play with these things non-surgically. And I think that's not a bad idea, whether you do that and that's all you do, or whether you want to get a preview of what maybe a bigger jaw surgery would do, because it can show you if you like that look, and if you don't, you let the fillers and Botox wear off and it goes back to where it was before. So I think it's a good thing for people to play with some of those things before jumping in and doing the big surgeries right out of the gate. If you look at a photo of her, just an overall side-by-side of her when she was younger and not totally present day, but sort of in between, we can see some gradual more changes to her face, and some of that may be normal, just changing, getting a little older, getting a little more mature. Some of the baby fat coming out of the face, contouring of the face, but things that wouldn't change on their own are the brow position again. Your eyes aren't going to lift up, they aren't going to open up more, you're not going to see more lid, you're not going to have as high of that fox tail to the brow just by chance and by aging. So those things I do think were altered. And again, most likely either a lateral brow lift with possibly a little bit of mid-face lifting to give that really pulled up look and fox look to the side of the eyebrow. And then secondly, in combination or together, some threading, some brow threads that pull up the brow. Those are dissolvable. So again, that's a nice place to start, because if you don't like them, it'll come back down. Whereas the brow lift or mid-face lift, it's there, it's staying, it's permanent. So you got to weigh those things out. And then brow reshaping, makeup, all those things combined give that extreme look to somebody. And I think it's okay, and it works with her, and I think it's a very pretty look in her, but again, it doesn't work on everybody. So like I said, maybe play with some less invasive things before going right for the Bella Hadid brow and fox look to the eye. We're looking at her nose, definitely changes, right? So over time, we can see that bulbous plunging nasal tip that she had when she was younger, kind of lifting, the tip coming in, taking more shape, being, I think, a little bit over-defined in the tip, or pinchy. So I think as it's gone through its transitions, I think I would have maybe stopped one rhinoplasty before. At this point, I think it looks good on her, but you can definitely see some telltale signs of rhinoplasty, and that being that pinchy tip. And I do think she has a slight bit of a hang columella as well, and a little bit still plunging the tip. One of the telltale signs is in the bridge of her nose. Her bridge has been thinned extremely, and the bones have been brought in, it's been lowered, and it's been lowered so much that you can see what's called an inverted V deformity across the bridge of her nose. And what that means is the nose comes down, you see this in shadowing, that there's almost like a break in the nose. And that is from over resecting the bridge, and that it's not continuous anymore. And those are difficult things to reverse. So that's why I warn people, try not to go too extreme with the nose. What does that mean? That means if you want to fix that, you can't simply go in and fix with the parts that are there. You have to borrow from somewhere else. You're going to have to borrow from a rib. You're going to have to borrow from an ear. You're going to have to, or put an implant. You're going to, if you want to rebuild that bridge up, you're going to have to go through a pretty big surgery to do that, which is why I say be careful. Don't go right for the Bella Hadid nose today. Maybe refine it, see where you're at. You can always refine it more, but try not to overdo it. If we go to the most recent kind of famous picture of Bella, which is that striking picture with her hair blowing in the wind and the cheeks are all brought in and the brow is pulled up. Again, on her, beautiful. Looks, very elegant. And but again, is that how she looks every day? Is that with all the makeup and the lighting and everything we're doing? Probably a little bit of that. I do think her features, looking at her proportions of her face, very well done as far as natural kind of symmetry, shape, and proportion. She's got the perfect thirds to her face, from her forehead to her nose to her chin. Whereas when she was a little younger, this was a little more powerful. The mid-face was maybe a little out of proportion, with the nose being stronger and things a little bit not as balanced. So I do think that was a move in the right direction. And then as we're seeing that rested, pretty, elegant, pulled up brow, I think it really works and pops her eyes, and I think that that's really striking. When we're looking at her cheeks, again, very extreme cheek highlights, probably had filler, things pulled in as this was pulled up to really give that nice cheek highlight. Really comes in though in that buccal. I'm really suspicious of a buccal lipectomy in that most recent photo, because the cheeks are really sucked in like this. And instead of people saying necessarily that it makes her, people look older, what I'd say is it's more of a mature look. In other words, as we get a little bit older from our baby fat and our teens and the chubby faces, and we're supposed to naturally have that look come in a little bit, and our buccal fat pads are supposed to naturally resorb a little bit as we get a little more mature. So I do think it's a more mature, elegant look to her, supermodel, versus younger, chubby, baby fat chipmunky cheeks. So I think you can see that transition in her. Some of it's probably natural, and then some of it is surgically enhanced. And then lastly, looking at her lips, again, fuller, probably lip injections, bringing that into line. And I do think the jawline in that picture near the back here has been contoured or brought in as well. So suspicious there. If it's non-surgical, that she had BOTOX or something to shrink in and contour that jawline. I don't think she's had chin surgery or anything done to her chin. It looks like the mental crease, her chin projection, everything else was there naturally. So I think overall, bringing all of this into balance in her face has done very well. Even though I think the nose is a giveaway, I think with her it works, and I think overall for her it works. I would just be careful that that look and that nose and that eye is not going to work on everybody. So let me state that again. It doesn't work on everybody. Because people coming in saying, I want to look like Bella Hadid. Well, you know, we got to see what we're working with, what nose might look better on you and not exactly her nose or exactly her brow. Although I will say that brow look, that very, if it's not overdone, is a very pretty look that is a little more timeless, as long as it's not overpulled, overdone, so that, you know, that fox look can be very pretty, but it can also look strange if it's done on the wrong person. Take that with a grain of salt. One thing that I would suggest is if you like Bella Hadid's look and you want to go for that look, go somewhere where they can do some computer imaging on your own face or some, even your own filters. Put that look on your face and make sure you like it before you go and alter it permanently.
For other patients or prospective patients, is it common for that to be achieved in one surgery, that like extreme flatness?
No. To get that extreme flat bridge like Bella has now is very difficult to do in one surgery and not recommended. Why? Nose can collapse, different things. But overall, you generally see that as a progression. And the reason is when you're doing a rhinoplasty, you're not taking any of the skin out of the nose, right? So when you're, whether it's closed or open, when we're refining these things, you don't take the skin out, so it's going to shrink. You have to wait for it to shrink and then shrink again and then shrink again. And if you just took all that out and then wait for it to shrink wrap, it would look really strange. So generally speaking, when you see that extreme of a reduction in the bridge of the nose, it's been done in multiple surgeries.
So she must have been after that look, right?
It's hard to say. You know, I don't know. It catches my eye just because it's a break in the nose, and I don't like that because to me it's a distraction when I'm looking at somebody, and if I see a break or a, you know, dent or, you know, inverted V, it's taking me away from looking at their eyes. You're naturally going to be drawn to that flaw or that, you know, I don't even want to say flaw, but, you know.
Well, it's not natural. Say like you're drawn to it because it's not natural.
It's a distraction.
Yeah.
So you never want a distraction. You always want fluid lines, looking to eyes, lips. You don't want to be distracted by something that's, yeah, out of proportion or not a normal, smooth contour of the face. She should have nice, natural, smooth hourglass shape to the nose and nice curves to the cheeks. When things are pulled and extreme and out of proportion, your eyes are all over the place trying to figure out what's going on, and they're just distractions rather than, wow, she's gorgeous, you know, like. You're drawn to Bella's eyes because of that fox look and opened and she has these beautiful eyes, and then you kind of get drawn into that nose a little bit. So I personally would have left it a little stronger. Whether she wanted it that way, I don't know. It's hard to say. You know, part of that is the surgeon recommending maybe don't do that extreme, and part of it is that what she wanted, or thirdly, is it something where it was overdone and she doesn't like it? But like I said, hard to fix. Now, one thing you could do with her nose is a little filler into that inverted V temporarily, or to help blend it a little bit. You know, that is something that she could do to
make her nose larger.
Yeah, to blend that bridge a little bit so that it would look a little bit more continuous. The lines are flowing, so you're not seeing that little dent in the bridge.